Switch it over. I am going to introduce our guest speaker today. This is the lovely Sherry Kozabal. Sherry is a registered respiratory therapist with 29 years experience. She is also a registered polysonograph technologist of 14 years, certified respiratory educator for 3 years, and a certified clinical sleep health clinician for 9 years. So she comes with a wealth of experience. Although her experience started in the hospital and sleep lab, she has spent most of the time in the community helping people with breathing conditions such as asthma, COPD, neuromuscular conditions, and all types of sleep disordered breathing, such as sleep apnea. Sherry entered healthcare many years ago with the drive to help people maximize their health and find this blend of experience. And she finds this blend of experience that has really helped her immensely. In addition to her work in traditional Western medical field, she is also trained as a certified clinical hypnotherapist. Very interesting. She helps people with stress management techniques, reframing challenges such as addictions and perspective, and finally focusing on alignment with their best lives. Very interesting. Beyond her career, she tries to spend as much time outdoors hiking with her family and dogs, and she is an avid reader and loves to continue to learn and take courses in all different types of healthcare. So I feel we are very blessed to have her today and all her expertise. So I'm going to go ahead and pass it on to Sherry for her to introduce herself and the floor.
Lindsay, thank you so much for having me. Lindsay and Alexa, you guys are wonderful. I loved doing this last year with you, and you asked me again. I was just really excited to do this. So thank you for having me, and thank you guys for coming today. So I hope I can share a few things that might help you out with your journey. Everyone's going to probably take a little bit of something. It's very similar to what I spoke about before, but I took some notes basically from some of the questions that people had, and I made some changes and added in some new things for you guys. So hopefully this will answer a few questions for you. So I'm just going to go ahead and share my screen. Okay. Down here. All right. Can everyone see me okay? Does that look good, Lindsay?
Looks good. We can see it great.
Perfect. Okay. All right, so going ahead here. So basically what I want to talk to you today a little bit is about anxiety, breathwork, and mindset, and just coming back to the basics of what we do here with anxiety and breathwork and how it would apply specifically to lung conditions. I know a lot of people here are talking a little bit ahead of time with COPD, but there's also several different types of lung conditions we deal with, especially with respiratory therapists, COPD, asthma, IPF, lots of different conditions. So whatever you're dealing with, there is something that we can do with breath work. And that's my goal in integrating all of what I know from all of who I am and all the different things that I've done to help people with their breathing. So the first thing I want to start off with is just acknowledgement that I respectfully acknowledge that I live, work, and play on the traditional and unceded territories of the Snuneymuxw, the Snanaaz, and the Samunas peoples. And I really want to express my gratitude for their stewardship of these lands over generations and recognize the enduring connection they have to this beautiful place that I get to call home. So this is top of a mountain near where I live, and it was taken a couple years ago with my amazing dog. All right, so objectives. So what am I going to talk about this time? So COPD and anxiety, some of the similarities there, some of the differences, how mindset and breath work can help bring you back your control. Because I think one of the biggest things I talk to my clients about is to how to re-empower themselves with some of the tools that we can offer. We can just make people more aware of that they have available to them to bring back their control. And also the mind-body connection that is within breath work that goes back to several different techniques, whether it's scientific in the Western world or whether it's in the Eastern world. There's lots of different things we can do to strengthen that connection. And the reason why we want to look at that connection is because that is about empowering our clients. And then breathing techniques with a new focus. So, anxiety. Does this look familiar to anybody? Noticing things like mind racing, uh, vision issues, difficulty in swallowing, nausea, restlessness, wanting to run, jelly for legs, heart palpitations. If you look at all of these sort of symptoms that somebody has, this could be one of many, many different things. And basically, what it is it's the body telling us that there is something not right, right? So it's all these little red flags that's kind of trying to give us our attention. Now, the thing with anxiety is it's a future-based experience. So it's an emotion and it's characterized by all these feelings of tension, these worried thoughts and physical changes that go along with it. And it's a broadly diffuse reaction. So it's not in response to something that you know of. Whereas fear is present oriented. I'm going to bring this up here so you guys can see this better. Fear is present oriented and it's a short lived response to a clearly identified specific threat. So, fear has a purpose and it has a very important role in keeping us safe in our lives. Whereas anxiety as a general rule really doesn't have a function. So, this is why we want to address it. We don't really want to get rid of things like fear because fear is a useful thing. So, what we're really looking for is to get at the anxiety piece. So, anxiety. So, this is me back in 2016. This is part of why I became a hypnotherapist. If you look at me back in 2016, this is 9 years ago, I feel like I look about 10 years older than I am now. And part of that reason was because I experienced a lot of anxiety. So, I usually try to practice what I preach, and I started off on a journey myself just to kind of find out what I needed to do for myself. And then I started noticing all of these similarities that we would teach people with anxiety that we would also teach people with COPD. So the question is, how do you experience anxiety and how does it look to you? If you look at me here, I don't look like I'm upset about anything. I don't look outwardly like I have an issue. I don't look like this caricature that I just showed you. I looked relatively at ease, you would think it here, but inside I was experiencing something much different. So for me, I was experiencing everything on the inside. But what it did was it changed how my body responded. It changed how I looked. So stomach issues and just basically how I cared for myself, all these things, right? So the question is, what happens first for you when you notice things like anxiety? What sort of thoughts? Do you have a body reaction, or is it something else completely? And then the biggest question is, where do you start to find relief for yourself? For me, it was one little thing. Went and, got into CBT, and I'll get into that in a few moments, but looking at various sort of things that I could educate myself because as a healthcare provider, I'm all about the education and how that empowers you to make change. So it started with one little thing, asking questions and, trying one thing and then moving to the next. So, how could we experience calm? You fast forward 9 years later, this is me now. And how I experience calm is very different from how I would have thought I could experience calm back then. So, what I learned with all of that is that calm is so different for everybody, and calm is a journey. Calm is something that you get a little bit of a taste of in the moment with one thing that you're doing, and then it develops kind of like a good soup would, where you simmer it over time and you just give it its time to kind of simmer in place, and it just develops into this complex, beautiful thing. So the other questions too, what do you prefer to experience as people who go through difficult times? We think, okay, we have to survive things, but we don't often think about what we prefer to experience instead. We just think about surviving certain things. So I certainly wouldn't have thought about, doing some of the things I do today back then because I was more focused on just getting through each day with anxiety. Um, Yeah. Okay. So why do we go after anxiety so much? In this country alone, anxiety disorders are the number one most common mental health issues in this country, with approximately 1 in 10 Canadians suffering from an anxiety disorder or anxiety. In Canada, just in general, we have 18%. Or 5 million Canadians aged 15 or older met the diagnostic criteria for a mood or anxiety disorder. See, people with COPD are double that. So 36% of people with COPD or asthma experience anxiety, and there's a very good reason for that. So, what are anxiety disorders? People wonder what those are. You've probably heard of some of these panic disorders, phobias, PTSD, OCD, generalized anxiety disorder, or GAD. And with COPD, what we notice most is the generalized anxiety disorder or panic disorders, and then phobias, of course. Phobias are a little less common. So how do we treat this? Treatment, we often usually start with cognitive behavioral therapy, and pharmaceuticals is often paired with that when people are in quite heightened states. So the pharmaceutical piece usually tends to bring people to a space where they can receive the treatment. Cognitive behavioral therapy is based on the idea that thoughts and feelings and emotions will direct behavior. So if we can change the thoughts and we can change the emotions, we can change the behaviors. And there's so many different techniques of cognitive behavioral therapy. But what we see with cognitive behavioral therapy is that it most often involves breath work and meditation. So, and I love that piece because that is my total jam with hypnotherapy. So, what we're looking at changing when we use cognitive behavioral therapy is we're looking at shifting somebody's mindset, and we're not looking at brainwashing because that's when people talk about changing your mind. We're actually not changing your mind. We're changing how you see the world. So, a mindset is just, I always go by the American Psychological Association, and they talk about a state of mind that influences how people think about and enact their activities um, that either promote or interfere with optimal functioning. So, what they recognize there is that a mindset can be both negative and positive. And then the reason why we think the subconscious mind comes up with these mindsets, these general rules of how the world works is because it makes it easier. So if you have a generalized idea of how you feel about your work or how you feel about family or how you feel about different political or religious groups or things like that, then you've got this quick, easy mindset to refer to, and it takes very little effort to analyze things on the go. But the really important thing about mindset is one whole mindset about one whole topic starts with one thought. And that one thought is what you grow on. So, say, for example, you're driving down the road and you see a red car, and that red car cuts you off, and you have the thought, red cars are bad. This is out there, of course, but red cars are bad. And then, so what the mind does is it looks to see, is that true? And so, whether you realize it or not, your mind now is going to look and notice every red car for the next several days. And it's going to start to say, oh, yeah, look at that guy. He turned right on a red when you're not supposed to, or he, whatever. So, you start to build this idea about red cars, and that becomes a mindset. And so it's a quick, easy, retrievable thing to refer to in a situation. Now, that can either optimize your life or it can hinder it, can create a boundary for you. So, depending on what you choose in that moment, it is either based on a fight, flight, or a rest, and digest, or like a calm mode. So, these are based on how your nervous system perceives the environment. Is it a threat, or am I in this thriving mode? And so, if someone threatens your existence at some point, or like the car cutting you off, it's a sympathetic. So sympathetic is that fight, flight, and we use all these both these systems at any given time. but it is specific to the incident, which one we are going to find most predominant. So, in a situation where you are feeling threatened in some way, the sympathetic will be the most predominant tone. And the way your brain works will change dramatically. Your focus will zero in on that one thing, and your blood pressure will go up, different hormones will go through your body, and it changes how your whole body works. So, this is very important for how COPD works in a little bit further on here. Now, awareness is the really important key here. So if you are aware in the moment how you are responding to a situation, you can decide which tone you prefer to have. You can bring that rational mind back in and you can reason in that moment and you can choose whether you want to have a fight flight response or whether you want to have a rest digest response, a thriving response. It's totally up to you. So, what I wanted to notice or make you aware of more than anything for awareness, and what I came aware of as I was going through my own journey with it, is the familiarity, the similarities here between COPD and how we breathe with anxiousness or fight flight. So, with people with COPD, we often see because of how the lungs change and the chest wall changes that it becomes a little bit more difficult to move that chest wall, right? So, your body is designed to do everything with the greatest of ease for you to reserve energy and to give you energy for the things that you would prefer to do. So, in these autonomic or these unaware actions like breathing, um, when the chest wall changes in such a way that it becomes a little more difficult to either get the air out or get the air in, depending on what you're dealing with the COPD one, depending on where you're at, getting the air in at the end of exercising a lot can be difficult because you're very hyperinflated. Your lungs are open up quite a bit. Maybe you're not pursed lip breathing. Maybe you're not pacing yourself. You'll notice that breath in is difficult at the end and you have to stop. But what we find is that the body will change so that the breathing is fast and shallow to make it easier for you to adapt for COPD. But the problem is that mimics fight flight breathing because when we are being chased by a bear or guy cuts us off in on the road or whatever, um, we automatically move into that fight flight, and the purpose, the intention in that moment is to get as much blood, as much resources to your limbs to get you safe. So heart rate goes up, blood pressure goes up, respiratory rate will go up, get more oxygen, get more resources to do what you need to do to keep yourself safe. The problem is when we start breathing in this way, no matter what is happening, whether it's chest wall changes with COPD or any other lung condition, it's mimicking fight flight breathing. It's telling your body we're in fight flight mode and it's triggering those hormones to tell your body to respond that way. And that is not a life sustaining thing. This is not a thriving way of existing. So, this is where we will use things like breath work and mindfulness to help people become aware of their breathing with whatever lung condition they're dealing with to take that control back and shift back into that calm state of breathing. So, how do we do that? We use mindset generators. So, we want to change this mindset from this fight flight over to this beautiful rest, digest, thriving mode. And we're going to use things like meditation. We're going to use visualization. We're going to set intentions, use mindfulness practices like remembering we're in the present moment. We're not, 5 years down the road or tomorrow, or how am I going to do this when I'm not feeling very good? We're going to use physical activity. Sometimes physical activity we use to let off steam. Sometimes we use physical activity to activate things like with Tai Chi and Qigong, we're activating the calm part of our nervous system. Those exercises are meant to bring us back into that state. We're using things like breath work with the exact same intention as the physical activity, as triggering the calm part of the nervous system to remember that we are in this calm state. How we're talking to ourselves. Are you telling yourself that, oh, I can't do this, or this isn't going to go very well, or I feel like I might be getting sick, and what's going to happen with that? And next thing you know, you're visualizing yourself in a hospital when that's not even happened. So the internal dialogue, that's that thoughts that become feelings that shift you into that fight flight that don't set you up to have your immune system as optimal as possible. The other one is your external environment. It's like, if you hang out with crows, you'll become one, right? That's that old saying. If you are in an environment where it is high stress or not supportive of you, we know we are adaptive creatures, and whatever environment we are in, we are adapting to it. If you don't want to be in a stressed person, you don't want to be in a stressed environment. Um, so we're going to go more into these as we go through. So intention and focus. This is an exercise I love to do with most of my clients. Where your focus goes, your energy flows. So this is both a scientific and an Eastern sort of idea. So people that practice Qigong or Tai Chi or meditation, that sort of thing, what they're thinking about specifically is energy. So where they put their focus, their energy is flowing. When you talk about it from a scientific point of view, we are telling our nervous system to put your attention, to send those signals from the brain to specific parts of your body. What I find with mixing things like visualization and mindfulness and meditation and breathing is that we can use all of those things at once, to use all of those concepts to work for you in whatever way is most relatable to you. So if you all want to try this with me, if you want to give it a go, if you don't, you can just take a break. So what I want you to try is just sitting back for a moment, get yourself comfortable. You can lay down if you want to, it doesn't matter. Sitting down, lying, or laying down, sitting up. But I want you to close your eyes, because when your eyes are open, it is directing you to have your focus outside of your body. And the number one thing that we can do to empower you is to make you aware of your body. So what I want you to do is close your eyes and bring your focus back in. And we're going to start with 3 breaths. We're directing your central nervous system with 3 deep breaths. This is where most yogic breathing starts, or pranayama, to empower people. So it's taking the breath in through the nose and out through pursed lips. So in through the nose, filling up the lungs. I don't care how you do it, just do it. Exhale through the pursed lips. To your own rate, in through the nose and all the way out through pursed lips. 3 deep breaths. And as you're doing these breaths, and if you're finished, that's fine, just allowing your breath to go back to its normal rate. Bring your focus in, and I want you to notice where your focus is in your body. Most people will notice that their focus is in their head because they're listening to me. What I'd like you to do is imagine that you can visualize your chest from the inside. So I'm going to try it here. Taking that deep breath in again with me and letting it go. Starting here in the head, and then noticing if you could travel down from the head down into the chest, middle of the chest. And just imagine what it might be like in there. You can visualize a light. You can maybe visualize your heart. You can visualize your lungs nice and soft and supple. Don't make anything do anything. Just notice what it might be like if the lungs were soft and easy and flowed exactly the way you needed them to. Now put your focus down to the bottom of those lungs. Imagine you're drifting down like those little particles of oxygen all the way down to the furthest part of your lung. And if you allowed the belly to relax enough in that moment, you could maybe fit more of those particles down there. And just notice what happens to your shoulders. Notice what happens to your belly and your back. Notice if you had any thoughts while you were doing this. And if you did, were there fewer than before? Notice how your body feels. And just keeping in mind that the whole time you are doing this, that those directions that you gave to your central nervous system, that intention of bringing the focus in, that's all we had. And that direction that you had to go down to those spots, told those muscles, those nerves, those tissues to soften, to open, and to work for you better in a way that they were doing before. That happened because you directed your central nervous system, you empowered yourself. And when we do that, we're unleashing these beautiful hormones that work for you, that supports your body, and then create more emotions. And it's this beautiful snowball effect in a way that's supporting you instead of working against you. This is how we build new responses to our body, new neural pathways of calm instead of reacting. So if you've done that exercise with me, you can come all the way back, open the eyes, take a nice deep breath in, let it go, and just notice how your body feels. So, doing that exercise, what is within your control? You can see there's a lot within your control, and there is always another option to do breath work, to direct your body, to become aware of your body, and to seek help. There's lots of tools that we get both inside and outside with technique and education. And the biggest things are an awareness of who you are, how you are feeling in the moment, who you are as a person, what resonates and what does not. I can guarantee you, everybody who just did that exercise did it in a different way, and that is perfect. You shouldn't do it the way I did it. So I'm a guide, and it's the same with as I'm working as a respiratory therapist. I am educating people. I am not telling them what to do. I'm making suggestions, and they adapt it into their care as they see is supportive for them. And then the last thing, awareness of what you want, because you need a destination. You don't get in your car every day and just hope that you get to the place you want without knowing where you're going. So it's the same with your body. So surviving or thriving, every person here today has a 100% survival rate. So nice job, right? Everybody has a 100% survival rate. The problem is we're so good at it that we think that's all that we should do, and it's our strongest muscle. So what breath work and mindfulness and CBT and all this just does is it makes us better at thriving. That's activating that calm part of that nervous system, and we're bringing in things also like imagination. You noticed in that moment when we were doing that breath work, when we were bringing that awareness into the body, but there was this openness. It felt lighter, usually feels open, usually feels a little bit more possible, a little bit of hope in there, right? If we tag imagination into that visualization, it's amazing where we can go. So breath work. The foundation of breath work is that it's structured and it's intentional breathing exercises. And the aim is to improve both physical and mental well-being. They are very much tied together in that sense. The focus is always present moment. When you're structured and doing something like that, it's very difficult to be worrying about what you're having for dinner tonight or how you're going to get to wherever you need to go tomorrow. And when we couple it with imagination, we knock it out of the park. It's just 2.0 breath work. The beauty about breath work too is that we begin to realize is that breath itself is both autonomic or automatic in our body, So our body carries on doing it, whether we're thinking about it or not. But it also is a, a- an on point thing where we think about it and we can do it exactly how we want to do it. Okay. So pursed lip breathing. Pursed lip breathing is probably the biggest tool I have in my toolkit as a respiratory therapist, as a hypnotherapist. It's the tiniest little tool, but it's the mightiest. The most important thing about the pursed lip breathing is that it slows the breath rate down. And it allows that time for people with COPD, especially, to exhale, to get that old air out. While we're doing that, we're signaling the brain to calm because what we're doing is we are slowing that rate down the way that the diaphragm moves or how often it moves up and down. And when it's doing that, where it's massaging a vagus nerve in which is the main nerve of the calming part of the central nervous system. And when we massage that nerve, what we do is we make it so that the whole body calms down, right? So when we calm that breath rate down, we are massaging that nerve and getting the whole body into this beautiful state of calm. We're also inflating more lung space at the bottom of the lungs. I love that as an RT because I know people aren't going to be harboring mucus down there and harboring infections. And as a hypnotherapist, I know that when I do that, I'm activating more of that, the calm part of the nervous system in the bottom part of those lungs to activate more of that calm state for my client. We're releasing all that old air. And when we do that, more oxygen, better clinical outcomes for people. And when it's structured again, you can't worry when you're structured. The diaphragmatic breathing, it goes along very often with the pursed lip breathing. It's our backbone again of most breathwork techniques. It directly stimulates that vagus nerve by massaging it, activates that calm part of the nervous system. When we do that, we increase the stroke volume or the amount of blood that you get out of the heart at any given time, and then the tidal volume as well, which is your breath sizes. And then this triggers this decreased fight flight part of the nervous system. So it puts you more into that calm state. The other part that it does is it increases heart rate variability. And so, what we say is that this is cardiac or heart resiliency. So, better clinical outcomes in the end. So, anytime we can do that, it's a good thing. So if you look at short term versus long term slow breathing, we have positive things both right away. If you like a quick positive, and then breath work is your thing. If you like, good long term gain, it also delivers as well. So we reduce oxygen consumption, we reduce the heart rate, and reduce blood pressure. We increase calm brain frequencies, which puts us into that calm state of mind, and it just sets the whole tone for the body to be in this rest and digest and regenerate, rejuvenate mode. The long term, we're reducing risks of developing like different types of heart disease and type 2 diabetes. We're improving lung function. So our residual volume, which is that last little bit part of the lungs, of what's left in the lungs once you've exhaled everything out, it improves that. And it also improves the dead space ventilation. So that part of the lungs that don't really take part in oxygenation or getting rid of the carbon dioxide, we want to minimize that as much as possible. And this is part of what breathwork does for us. So COPD and breathwork, when we look at the markers of COPD, or the hallmarks here, is that we have an irreversible obstructive flow. So air trapping, which is that hyperinflation, that's that air that gets trapped at the bottom part of the lungs, it tends to keep that diaphragm more flattened, but not in that massaging sort of way for the vagus nerve. So it just tends to sit down there, and then it's difficult for us to get that better breath in, and reduces your tolerance to exercise. And we all know how important exercise is for how you feel, and your clinical outcomes as well. The other one is we call a ventilation perfusion mismatch. So different parts of the lungs that are overinflated or underinflated and not matched with where the blood flow is. So that means we're not getting the oxygenation that we need and getting rid of the carbon dioxide. So when we look at bringing breath work in, we're looking at specific types of breathing, like pursed lip breathing. And that pursed lip breathing is what creates that back pressure to pop the airways open and allow that old air to get out. And then our diaphragmatic breathing for calming the nervous system and improving our ventilation of the lung, and then coordinating the breathing on exertion for optimal heart workload. So when you go to sit stand, just remembering that you're not holding your breath and that you're exhaling with the exertion. Everyone who's done pulmonary rehab knows these things here. Asthma and breath work. So the hallmarks of asthma is that we have a reversible obstructive flow to air in the airways, and that the airways are triggered by things in the environment, both internal and external. So stress or things outside like dust or different triggers like heat or humidity. And then the focus, of course, for the breath work is going to be things like the pursed lip breathing for the benefits of the nasal breathing. So the nasal breathing, important that we warm the air, we filter it and we humidify it so it's optimal for the lungs. And we're also increasing the nitric oxide in the body, which is calming the body. It's a calming effect on everything as well. And it opens up the blood vessels and allows better blood flow to different areas. The lung recruitment and the rate control also is, the other benefits with the pursed lip breathing. The difficulty with the asthma is it's a sudden onset, and it can be quite alarming for someone. And when it comes on quite suddenly like that, it's perceived a bit more as a acute or mm, more robust threat, let's put it that way. And then, so the body will respond in a much higher fight flight way. So when we can calm the breathing with that rate control, we can bring the control back from that stress response of what's happened from a trigger like, dust or cats or whatever. And we can bring part of that control back to that client by helping them control their rate. When people with asthma too, they practice breath work. They have this knowing that they know how to get their breath under control, and it's just a practice thing so that when it happens in a, a way that is disturbing, they can bring it back under control a little quicker just because they practice. We use things like the diaphragmatic breathing as well, again, to massage that vagus nerve. The 4-7-8 breathing, which is like box breathing, but it's like a longer hold and a longer exhale. And the pranayama breathing in general for this calming effect for that sudden sort of danger feel. So the breathwork techniques, there's so many different kinds. The box breathing is a big one. I don't often use it for people who have any obstructive flow, a chronic obstructive flow like COPD, because they need the longer exhale time, but it can work really well for people who have asthma because their lung functions would be very normal, except for when they're being triggered. There's cyclic sighing as well. This is to recruit more of that lung space and just to get that recruitment of those lower parts of the lung, teaching people to take those deeper breaths in a cyclic sort of way. Diaphragmatic breathing, which is that belly breathing. The coordinated breathing, which is helping people tolerate exercise, the pursed lip. The 4-7-8, yogic, and mindful. So the 4-7-8, if you guys want to try this one with me, it's a pretty simple one. It's very much like the box breathing, like I said. And the whole point is when we slow the rate down, we're slowing it down to 6 breaths a minute. And 6 breaths a minute is what is in the literature for showing the positive effect on the heart or the heart rate variability, and the calming part of the nervous system. So if you breathe in for 4, and the trick is breathing it in through your nose if you're able to, if you're not, breathing in through your mouth. Hold for 7, and then exhale for 8. And you notice I didn't count. It's an estimate when you're starting. So in essence is you breathe in for a certain amount of time, you hold that for about double the time, and exhale for double the time. Okay, so if you're able to only breathe in for 2 or 3 seconds, you're going to hold for about 5, 6 seconds, and you're going to exhale for about 6 seconds. Okay. For people with IPF, what they find is that it's harder to bring the inhale in. So they might find that the box breathing might be a little bit easier for them. People with COPD love this one because we are giving them that time to exhale. Okay, mindful breathing. So the mindful breathing, this one, I really want everyone to give it a try if you have a moment to do so. This is really going to calm everybody down. So again, just getting yourself comfortable, sitting back in your chair, taking in the breath in through the nose, exhaling through the pursed lips. When you're ready, closing your eyes down. Deep breath in and all the way out. Go at your pace, making sure you take all 3 breaths and pull your focus in. So you can hear my voice, but I want you to notice your body. I want you to see if you could notice how the breath feels moving in through your nose. Notice the coolness of the breath, the freshness of that, and how it warms as it moves down into the lungs. And as you exhale, the warmth and the humidity of that breath. Notice the shoulders and how they might want to soften with that breath. Notice if you have any thoughts that come up around that. How is your body feeling? Do you notice any tension anywhere? Any tightness? Maybe if you could imagine if there was a tightness or a heaviness in the body, that you could breathe through that spot in the body. Imagining when you take a breath in that you're breathing through that spot. And as you do that, that spot might become lighter or brighter or smaller, more diffuse maybe. Might be a different color that you might notice. Just notice what you notice. There's no right, there's no wrong. Okay? Notice any emotions that might come up with that. Sometimes there's emotions and they don't make sense. It's okay. We're very good at storing emotions in the body. And when they come up to release. So you might notice things like sadness, release, joy, sometimes laughter. And just see if they need a breath and give them a breath. This is all about here and now. The more familiar you become with your body, imagining the lungs, how you want them to look. Imagining how soft they move, how the diaphragm gently and with the greatest of ease moves up and down like a bellow that moves like an ocean wave. Or maybe it's like a seesaw you were on as a kid. Or maybe it's like a swing. Or maybe it's like a balloon. However you want, this is your moment to decide how that feels. Loosening the belly, allowing the shoulders to drop even more. Putting your focus down on the belly, noticing the breath coming in through the belly, allowing the belly to take it in as it rises and falls. Again, notice what comes up. We're not fixing anything. We're not changing anything. We're just becoming aware. But when you're ready, you can take a deep breath, let it all go, open your eyes, and come all the way back. And just notice how that was for you. Notice what there was, no judgment. Don't worry about thoughts or emotions or feelings that came up. They don't mean anything. We're just becoming aware. Okay? So yogic breathing, basically, it's referred to as pranayama. I really love yogic breathing. I think the first time, as many years ago, I took yoga and I did a breath work with a yoga session, and I was gobsmacked at how they could help me move air, just how they describe it, where they describe putting your focus, the words that they use. It's really an art on breath work in the pranayama. So one of the studies that I looked at was a study done, a Journal of Traditional and Complementary Medicine. And it was done with a group of veterans with PTSD, and they used Brahmari, a pranayama, which is the buzz breathing. And what it is they showed these veterans over so many weeks to use this breath, and it's basically humming as you're exhaling. So very similar to pursed lip, but you're using the humming at the back of the throat to create a sound and slow the breath down as you go. And what they found is that there was, by continuous practice, we're reducing dead space ventilation, we're decreasing work of breathing, and we're having a positive impact on cardiovascular and respiratory functions, and improving autonomic system towards this calm, dominant tone. And this is really important in PTSD, where people are always flipped into that fight flight response. So pranayama, the last time I did this talk, everybody wanted to know more about pranayama. So I dove deep into it from my respiratory lens. And just as if you're curious, that prana typically is translated into breath or life force. Yama is to extend, expand, or control. So basically to control the breath, right? And so it's an active control of the breath. So and it consists of three components: inhale, a hold, and an exhale. Sound familiar? I think we do this a lot with our breath work, just in general. So the three that stood out to me was the Durga pranayama, and it's a three-part breath. It's very similar to diaphragmatic breathing, but the instruction is different. So first you fill the abdomen. So you think about the abdomen itself, put your focus there, fill the abdomen. So it's the third fill of the inhale, and then inhale again to the lower part of the rib cage, and then the final inhale to the top of the breath to the collarbones. Okay, and then you exhale long and slow. So it goes like this. So it's a followed by a regular breath. and then again. And what you'll notice is if you close your eyes and do that, and you visualize where those sections of breath need to go, you'll notice that you get better movement that way, as opposed to when you have your eyes open and you're trying to think it through. So visualizing as opposed to thinking it through can be really helpful to recruiting the parts of the breath. So give it a shot. So closing your eyes, relaxing the belly, opening the bottom part of the belly, middle part of the chest, upper chest, long, slow exhale. And then they reverse it as well, where you can do a stepped exhale. So it's a long inhale. Exhale the top part, second part, lower part. So it's just being aware of how the air is moving in your body. Okay. Then the Brahmari pranayama. I'm going to demonstrate this one for you. It's so I apologize. It's not exactly a good singing one, but here you go. So you'll notice with how you constrict your throat, you can change the buzzing sound. And I hope you can hear this, but it's hard to say. So it's a big inhale and an exhale is a buzz. So it's And so what they find with this one is there's several different parts with this one. So the way it works is we're stimulating nitric oxide release, which is causing better blood flow in the system. It's stimulating the pineal gland, which is a little gland in the middle part of the brain that brings on this calm. And there's also the vagus nerve that comes up through the neck. And there's all these facial nerves. So the Brahmari pranayama can also be done for several different things. There's a Brahmari for meditation. There's one for sleep. There's one for mental clarity. There's five of them all together. But depending on where you stimulate the facial nerves, so you can put your fingers on different parts here, stimulating the facial nerve. And the other thing is that they close the trochanter, which is the front part of the ear, to close the ears as you're humming, and it amplifies the sound. The one that where you're touching all parts here and you're closing here and then making the buzzing sound is very good for headaches. So yeah. The last one is Viloma pranayama. So against the wave breath. So you inhale for 2 to 3 seconds, pause and repeat until you're full. So that's a full exhale. So it's very similar to the Durga, but it's this inhale and it's this stepped way of doing it. So it's inhale. And then reverse. Okay. So again, just getting that control back to the breathing. So finally, creating hold on, sorry. Here. Create a routine based on your preference. This is all about you. Make it unique. Make it something that works for you. Hold it for 2 seconds. Hold it for 3 seconds. It really doesn't matter. What matters is where you find your greatest difficulties with. So people with IPF, they have that difficulty with taking that breath in because their lungs are a little bit more stiff, whereas COPD is getting all that air out. Using those breath exercises to complement what you're dealing with, and then speaking with your respiratory therapist and healthcare provider to help you with choosing some of those as well. And keep it fun. Bring in imagination, mix it up, do what works for you on any given day, and don't get stuck on those rules, okay? The best routine fits your unique preferences and your unique lung condition and make it work for you. And then finding that perfect recipe for you takes time. the when you go back to pranayama there, the one exercise, that B breathing, the Brahmari breathing, is the only one that they say that shows you immediate effects in what you're looking for, whereas the other ones take time to develop those positive effects. So it's not a magic pill. This is like pulmonary rehab. It's a lifelong thing, and you'll start to see those benefits and you'll keep seeing them, and then you'll find that perfect recipe where as you go. So know what affects you and just keep going. Okay. So summary, anxiety can manifest as a feeling or disorder. It is up to you to decide what works best for you. Okay. Oops, sorry. Um, and you have many internal and external tools. We have so many things to empower our clients. So it's just becoming aware of what works for you and expanding on that. Okay. CBT is the most common approach. It might not be something that works for you, but we know that things like breath work and forms of meditation can focus on supporting you overall with COPD or even with not a lung condition. The biggest importance with all this breath work is the rate and the depth, okay, of the breath for that central nervous system stimulation to get that calming effect. And the breath work effect is amplified if you add in that intention, knowing why you're doing it, what you're looking to get, and the imagination. Okay, and that's it. And those are my references. So thank you very much, guys.
Thank you so much, Sherry. That was very informative, and you have the most calming voice to listen to. Um, I'm going to open it up. I know we don't have a lot of time, but if there's any questions, feel free to jump or drop them in the chat or just come off mute and ask your question. One question that was asked in the chat is by Wanda is it possible to get a copy of your PowerPoint? So Wanda, this is actually all recorded. So this will be on the Better Breathers, the BC Lung Foundation YouTube channel. Maureen did put it in the chat. If you want to just click on that and it shows all of ours, it should be up in the next day or two. Is there any other questions for Sherry?
Yes, I have a question. First of all, can I speak?
Go ahead.
Okay.
You are.
I hope you're hearing me.
Yeah, I can hear you.
Okay, thank you very much for an absolutely wonderful presentation.
Oh,
What is
thank
the
you.
role, what is the role of mucus in the lungs? I have IPF and I have a lot of mucus. And
Yeah.
one of my big challenges right now is to minimize that. And I'm
Right.
wondering if breathing plays a role in that or not.
Absolutely, it does. So mucus is, I mean, it's just a natural part of how the lungs work, right? So it helps them with staying supple and moving the way they need to. It traps things that don't belong there and allows us to get rid of it. There's just many, many different functions for it. In chronic lung conditions, we often see the production of the mucus elevated because the lung is responding to um like it's an inflammatory response. It's overreacting to what's happening in the lung, so it tends to produce more mucus. What I would suggest, are you working, what was your name? I didn't get your name.
Brian Patterson.
Brian. So
Yeah.
Brian, what I would suggest is when you're talking with your do you have a respiratory therapist you're working with in the community?
Yes. Yes.
Okay, so what I would talk to them about is, are there medications that you can take to reduce how much your lungs are making mucus? And then also, are there tools that you can use to move that mucus easier for you? So I talk to my clients all the time about this, about making the mucus more easier to move, so more fluid. Because if it's thick, you can't move it. It doesn't matter how well you cough, you're not going to move glue, right? So about talking to them about, is it thick? Is it too thick? Is it too thin? Is there medications I can use to reduce it? Are there tools I can use like OPEP devices and things like that? So there's lots of respiratory therapy techniques that we can use for those certain things, but it really is individual what we will suggest. That's why I always send people back to their RT to talk to them. And then that RT often will talk with the respirologist with the plan about, okay, this is working, this is not, we've tried this isn't working, now what? My biggest thing with people for advocacy is now what? Now what? This isn't working, now what? Okay?
Okay. Can I get just the last
Yeah.
comment on that? In the
Yeah.
last couple of days, I've seen about a number of reels on Facebook about
Yeah.
a home remedy, and the base of it always seems to be honey and onion, honey and orange, honey and lemon, honey and everything.
Yeah.
Uh,
Yeah.
and I'm trying it now, and I don't know if it's going to work or not, but
Mhm.
it would be great if there was a home remedy rather than a medication.
Yeah, you know what I always suggest, and I'm a total advocate for looking at everything and how your diet and everything affects you, right? So what I would suggest is talk to your pharmacist and your primary care practitioner about what you're taking and what's going to interact or not interact with your medications. And if
Yeah.
it's not, right, and it's resonating with you, working sometimes with a nutritionist, someone who really knows nutrition and why that's working or doesn't work for you. There's all kinds of people with these nutrition backgrounds as well, and especially with like we have with Island Health here or all the different health authorities. So accessing those people to see because even with natural things, you also want to look at, are you optimizing that, right? So food is medicine as well. So, but how you take it and how much you take it. So it's just really good to be guided by somebody has that education and have them speaking with your primary care practitioner. So you're all working as a team. Okay.
Thank you very much.
Yeah, you're welcome.
There was another question in the chat, but I'm just not sure, Lynn, if it was typed wrong. Is the exhalation with B breath per slip or nasal?
Yeah.
It's so with the pursed lip breathing.
So yes, I just wondered, sorry, I just
Yeah.
yeah, I see it wasn't that clear.
No, that's a great question.
I wasn't sure if, because I know that there are some breathing techniques where they say, for calming effects that
Yes.
it's good that it's all nasal in
Yes.
inhalation and exhalation. But I
That's
just
a,
wondered, yeah, with the B breath, if with the humming,
yeah.
is that all nasal breathing, or are you doing pursed lip exhalation with the humming?
Yeah, the humming is supposed to be all nasal. That's a really good point. So with the pranayama, yeah, they often will just use the nose because they're maximizing the nitric oxide effect, which is that calming effect. But again, this is where breath work and knowing what you're dealing with, because if you, it drops your blood pressure, right? When you're using that calming effect like that. So just understanding who you are and where your blood pressure is and how you're feeling with things. So adapting it. So even if they say with B breath, like to do it only with nasal breathing, that is their typical. But even with the Brahmari, the B breath, there's so many variations of it for different purposes. And where you're activating cranial nerves and using the nose or the mouth as well. So I think again, go back to that individual effect and what's working for you. Doesn't have to be, don't get stuck on the rules.
Wonderful. Thank you very much. This was excellent.
Good. I'm glad you liked it. Yeah.
We are over 3 o'clock, but we probably have time for one more question if there is any more. So much. But if you have, we probably can take one more question, then we'll have to end for today if there's any more. Also, I don't see any hands. Okay, well, what I'd like to say is thank you so much, Sherry, for coming and speaking with us today. This presentation is always well received and loved. We're getting tons of thank yous in the chat. So thank you again for coming and speaking with us today. Just a reminder to everyone, Our last presentation of the year is on December 17th at 2 p.m. and it will be how COPD patients can advocate for their health. So a great run-on from this presentation. Thank you so much, and we hope everyone has a wonderful
Thank you,
Thank you very
everyone.
much.